Welcome to aminacademy.com. In human anatomy and physiology, let us discuss about leukocyte disorders. This is general term used to indicate an abnormal reduction in the number of circulating granulocytes, commonly called neutropenia. In conditions where the spleen is enlarged, excessive number of granulocytes are trapped, reducing the number in circulation. Neutropenia predisposes to severe infection that can lead to septicemia and death. Leukocytosis, an increase in the number of circulating leukocytes occurs as a normal protective reaction in a variety of pathological conditions, especially infections. When the infection subsides, the leukocyte count returns to normal. Leukemia. Leukemia is a malignant proliferation of white blood cell precursors by the bone marrow. The result in the uncontrolled increase in the production of leukocytes and or their precursor. As the tumor cells enter the blood, the total leukocyte count is usually raised, but in some cases it may be normal or even low. The proliferation of immature leukemic blast cells crowd out other blood cells formed in bone marrow, causing anemia, thrombocytopenia, and leukopenia. Causes of leukopenia. Leukemia. The causes of leukemia. Some causes of leukemia are known, but many causes cannot be accounted for. Some people may have a genetic predisposition that is triggered by environmental factors, including viral infections. Other known causes include ionizing radiations, chemicals, genetic factors. Some type of leukemia are acute leukemias and acute myeloblastic leukemia AML, acute hypoblastic leukemia ALL, chronic leukemias, thrombocytopenia, vitamin K deficiency. Now, let us discuss further about leukocyte disorders. Leukocyte disorders encompasses conditions where there are abnormal number of or functions of white blood cells, leukocytes, which are the type of blood cells that fights infections. These disorders can manifest as either too few leukocytes, leukopenia, or too many leukocytes, leukocytosis. Leukopenia increases the risk of infections, while leukocytosis can be a sign of infection, inflammation, or underlying medical conditions like leukemia or lymphoma. Leukopenia, low white blood cell count. Leukopenia is also known as low white blood cell count, means having fewer than the normal number of leukocytes in the blood. Leukopenia is a condition characterized by an abnormally low number of white blood cells, WBCs, in the blood. White blood cells are crucial for the body's defense against infection, so leukopenia increases the risk of infections. What are the causes of leukopenia? Leukopenia can be caused by various factors, including infections, certain medications, autoimmune disorders, bone marrow problems, and some cancers. Symptoms. The most significant symptoms of leukopenia is increased susceptibility to infections, which can range from mild to life-threatening. Some examples. Neutropenia, a specific type of Leukopenia, characterized by a low number of neutrophils, a type of white blood cells that fights bacterial infections. Lymphopenia, a low count of lymphocytes, which are white blood cells involved in immune response. Leukocytosis, that is high white blood cells count. Leukocytosis refers to an increase in the number of white blood cells in the blood. What are the causes? Leukocytosis is often a normal response to infections, inflammation, or stress. However, it can also be caused by underlying medical conditions, including certain cancers and autoimmune disorders. What are the symptoms of this? While leukocytosis can be normal response, it can also indicate an underlying problems that needs medical attention. For example, neutrophilia, elevated levels of neutrophils often seen in response to bacterial infections. Lymphocytosis, increased level of lymphocytes which can be caused by viral infections or other immune related conditions. Eosinophilia, high levels of eosinophils often associated with allergies, parasitic infections, or certain autoimmune disorders. Eosinophilia is a condition characterized by an elevated level of eosinophils, a type of white blood cell in the blood. It's typically defined as a peripheral blood eosinophil count greater than 500 per mcl, that microliter. These conditions can be response to various factors including allergic conditions, allergic reactions, parasitic infections, and certain medical conditions. Leukemia is some cases. Leukocytosis can be sign of leukemia, a type of cancer that affects white blood cells. Leukemia is a type of cancer that affects the blood forming tissues, including the bone marrow and the lymphatic system. It's characterized by the abnormal production of white blood cells, which can hinder the production of healthy red blood cells and platelets. These are different types of leukemia, some more common in children and others in adults. Diagnosis and treatment. What are the diagnosis and treatment of leukemia? Diagnosis typically involve a complete blood count, CBC, and possibly other tests like a bone marrow biopsy. Treatment depends on the underlying causes and severity to the condition. In some cases, no treatment is needed if the leukocytosis is a temporary response to an infection or stress. For more serious conditions like leukopenia or leukemia, treatment may involve medications, blood transfusions, or other therapies. So far, we discussed little about leukocyte disorders. If you have done, please subscribe our YouTube channel.